So, Congressman Pallone, I'd love to give you a chance to comment on anything that the senator just said.
Well, the senator always tries to be bipartisan. He works obviously with Patty Murray, and I regret the fact that he's leaving in the next few years, because I think he's really one of the key people in the Senate that's always trying to work together with the Democrats, with the House. And I think his optimistic view, Kathleen, about things that we can get done, makes me hopeful that we can actually accomplish some of these, address some of these concerns on healthcare.
I'd like to start out talking about something we heard a lot about in the fall and is still really a major point of discussion right now, and that's the concept of Medicare for all. According to USA Today, about half of Democratic candidates in the fall backed the concept. Many of them won. What do you think about it?
Well, look, the goal is always universal health care, as much as possible to get all Americans, or as many Americans as possible, to have health insurance or to have coverage so that they get access to health care, because access and affordability are always the big problem. So, I mean, Medicare for all is certainly a concept that we should be looking at, but, it's not something that the president would support or that the Republicans would likely support. So when you talk about, doing things that can actually get done and get signed into law, that's not likely. So for me, it's more, I guess aspirational, as if you will. But there are a lot of ideas out there. I mean, there's a Medicare buy-in. There's having
it's for people 50 to 64.
Right.
Do you like that idea?
Well, I think that it's, again, all these things, public option, Medicare buy-in, Medicare for all of them have to be looked at. But again, I'm trying to focus in energy and commerce mostly on things that we think we can get done in this 2-year session. And so most of our focus is on stabilizing the Affordable Care Act because of all the sabotage by the Trump administration.
On that point, I read a fascinating article Saturday in the New York Times that detailed this coalition that has come together of insurance companies, healthcare companies, pharmaceutical companies, and to target Medicare for all. And one of the ways they're going to do that is by instead better supporting, more fully supporting and touting the benefits of and trying to improve the Affordable Care Act. They want to do things like expanding subsidies, stabilizing premiums. Have you heard about this coalition? What are you appreciate this support?
Well, look, I obviously everybody's free to do whatever they want. It's a free country, and freedom of speech is a basic tenet. I am concerned because I don't want, the continued polarization. Somebody comes up with an idea like Medicare for all, it's not helpful if a group of people start to, spread misinformation about that. But to the extent that...
Do you think that's happening?
Well, I have no idea. Who knows what anybody does, right? But I do think that focusing on the Affordable Care Act and the benefits of that and how that can be improved is helpful. We have this ACA stabilization bill that myself, Richie O'Neill, Bobby Scott, the 3 committees of jurisdiction chairs have put out. It was part of our better deal that we ran on in November. And that's kind of the focus of what I'm trying to do. So it basically addresses the sabotage, right? So,
and you're having hearings on that, correct?
Yeah, we are. And you mentioned, for example, remember when we did the ACA, it was envisioned that we would periodically go back and review it. And so when you talk about the tax credits or the subsidies, I think it's clear now that people that are a little higher income level that were not eligible for those subsidies before, that we need to raise that. So, for people of a higher income, because there are people now that are, say, making over $85,000, $90,000 a year who don't get any subsidy. And in a place like New Jersey, that's not a lot of income, right, for a family of 4. So, the stabilization bill deals with trying to open up the tax credits and subsidies more. But the main thing that we do is to try to stop this effort by the Trump administration to sell junk plans, to have plans that, don't provide essential benefits, that discriminate against preconditions. Those are the types of things that are really undermining the Affordable Care Act and need to be addressed.
How concerned are you about the ruling in December by the Texas Federal District Court judge that the Affordable Care Act is unconstitutional?
Well, see, that's the thing that bothers me is that, the Republicans, when Trump came in and the Republican majority tried to repeal the Affordable Care Act, fortunately, we ended that. But now they go into the courts, they forum shopped and found this, district judge, ideologically oriented in Texas, to do this ruling. And, they're very hypocritical because on the one hand, and this is where Lamar Alexander is different, okay? Because those on the right are still trying to repeal the Affordable Care Act and not really trying to do things that would make it work better. The thing I like about Lamar Alexander is, although he did indicate it wasn't likely that the Senate would address the ACA, I haven't given up on that. And he's someone who I think is saying, look, maybe, with the hearings and his initiatives in the Senate with Patty Murray, they were actually trying to do that. They were trying to stabilize the ACA and not just repeal it, but look for ways to improve it. So hopefully we can do some of that.
And are you concerned at all because it seems that enrollment has been dropping? I understand that right after it was passed, we got the number of uninsured Americans down to 9%, and now that's back up to 14%. What's going on?
Well, I think because the sabotage, by the Trump administration is making access more difficult and affordability less likely, right? So in other words, if you eliminate paying for the copays for lower income people, if you took out with their court action, made it possible for a lot of states not to expand Medicaid, which is another major issue that needs to be addressed. All these things are going to make it less likely that people get insurance, and insurance is going to be more costly. So that's why the stabilization is so important. It's clear that when you talk about Medicaid expansion, we had 3 states, I think, in November that voted in referendums to expand Medicaid in places where the legislature had refused to do it for ideological reasons, in my opinion. So, people want the Affordable Care Act. They do believe that the Medicaid expansion will be helpful, but the Republican leaders continue to thwart all that. That's the problem that we face.
We were mentioning Medicare for All at the beginning of our discussion, and some people do feel that that may go too far. Do not Democrats, when you look at what happened in November, really have a health care mandate? What do you think you can best do with that right now?
Well, I think the mandate...
if not Medicare for All.
I think the mandate in November was primarily concerned about pre-existing conditions, that there's so many people... almost everybody at some point has some sort of pre-existing condition, right? It may be more serious than others. And I think there was a fear on people's part that the Republicans are really going to bring back the discrimination and make it more difficult. And the junk plans relates to that too, because if you go out and buy a plan that doesn't have, a lot of the essential benefits, maternal health care, behavioral health issues, whatever, then your pre-existing condition problem is aggravated. So I think that was the mandate really on our more than anything else. Make sure that people aren't discriminated against because of pre-existing conditions. Make sure you're able to buy a plan that provides essential benefits. Lamar Alexander talked about transparency. Transparency is important. I'm not saying that just having things transparent with regard to pricing or the plans that are available for health insurance is enough. But it's certainly a step in the right direction because, if you empower people and they know what's going on.
You were talking a lot about what Republicans have been doing, to dismantle the ACA and get in the way of your efforts. Is there any tension within your own party on healthcare, especially when you look at some of the younger or the more vocal folks on the left wing?
Well, see, it's very easy, and I'm not being critical because I'm an advocate for universal health care, but it's very easy when you talk about Medicare for All to say, oh, let's just do that, and it makes it like the whole system is so simple. We'll just have Medicare for all, and
Flip a switch.
we don't have to worry about co-pays and deductibles, and I don't have to choose plans and all that. But remember that Medicare doesn't really cover everything either, right? I mean, it doesn't cover long-term care, right? People still have problems with deductibles and co-pays and everything else. I think that a lot of times when people think of Medicare for all, they just assume that nobody's paying for it, and it covers everything, I mean, when we were trying to do the when we were doing the Affordable Care Act, I was trying to put a long-term care component, and we realized very quickly that that would have cost more than the entire Affordable Care Act, because we were operating within $1 trillion that we had to spend, because we had to pay for it, and that would have cost even more than another trillion. So I think you have to be realistic too and say, let's look at all these things, right? Let's look at single-payer systems. Let's look at Medicare buy-ins. We had a public option in the House version of the Affordable Care Act. I was a big advocate for that, but as you know, we lost the 60 votes because of Senator Kennedy's passing, so we had to pass the Senate bill, which didn't have the public option. I think public option is great too.
Senator Alexander and I discussed prescription drug pricing a good bit. Do you think that that's one area in the House where both parties can come together?
Absolutely, and I've had a discussion with him about that. And I think because the president is out there on the stump saying he wants to lower prices because of people like Lamar Alexander in the Senate, that's definitely something where we can take the initiative and I think have a good chance of passing something. And that can take various forms. I obviously would like to see negotiated prices under Medicare, which actually the president from time to time has said he supports, although I don't know on a given day what he supports, but he has said it on occasion. And then
what about the international indexing?
Well, that's, I think, something that needs to be looked into. It's certainly an interesting idea. But remember, the problem with the Trump administration is most of the time when they get serious, they seem to be talking about voluntarily getting the drug companies to lower their prices. And I don't think that really works, right? You do have to do...
They discussed that at the hearing yesterday.
Yeah, I mean, it's all very nice.
Like, you control the bottom line,
Yeah,
why don't you just lower your prices?
I mean, bad actors don't usually do good things, So not that the drug companies are bad actors. Some are, but not all. But the other thing, of course, is, and Lamar mentioned that too, is generics, right? So we have the CREATES Act, we have the pay for delay, the legislation that makes it more difficult for brand companies to put roadblocks in the way of generics coming to market. I mean, we had a hearing once in the Steering and Policy Committee where a professor from one of the major universities came in and said, why are you Democrats talking about generics? Generic competition doesn't really exist anymore. But it may be that it's not as effective because of the roadblocks the brand names have put in place. But if you eliminate those roadblocks through things like CREATES or pay for delay legislation, then then generic competition can be more robust, which I believe in. So we'll probably do those things too.
Well, let's go to our audience now for questions. We have a microphone here. Again, if you would just identify yourself. And we have a question here in the front. Give us just a minute to get our mic runner here.
Hey, I'm Dominic Fischera. I work at NAVA. We're a consulting company that works with HHS administration. I wanted to go back to one of the first points you meant on ACA stabilization. The point about potentially expanding subsidies to higher income.
Or making the subsidies bigger for people that have them now.
Sure. This was interesting for me after working on the policy sort of academically through working in healthcare.gov and then helping my sister enroll. She fell into the income bracket that you're talking about, where the cost of subsidized care would have been, let's say, $4,000 out of pocket for their family, but then because of the income increase, it went up to $12,000 a year for their family, which is a significant difference than the raise in their income. What this comes back to is something that the ACA never addressed directly, and as someone who's an advocate for universal coverage, this is difficult, but the cost side of the problem. Because the cost of premiums and deductibles has continued to rise in the individual market, we can control it only so much as we're willing to subsidize care for people. So I'm just curious if, as part of that stabilization, you're looking at measures to potentially increased competitions in those markets to drive down the premium costs, because we can only subsidize as far as our budget allows us to.
Well, I'm not sure I'm answering your question, but I think the one thing we haven't discussed, and this was something that Senator Alexander was very much involved with, although he didn't mention it today, was the reinsurance component, right? Which is also part of our effort with stabilization, which is in many markets, including mine in New Jersey, you have fewer and fewer insurance carriers because they don't want to take the risk. So if you have some major reinsurance components, which Senator Alexander actually had worked on with Patty Murray, and which we're talking about now in the Energy and Commerce Committee, then you can bring more carriers in and create more competition. Because after all, the ACA was a competitive market and is a competitive marketplace, a notion, and that competition has, the sabotage, if you will, has impacted the lack of competition. I mean, I constantly, I never forget when we had all the, in August of the year when we passed the ACA and, all the right wing came out and said, you're all communists. I mean, I was at a town meeting in my district. There were like literally 3,000 people. We had to have 2 different sessions. And they had a huge sign that said Frank Pallone was a communist, right? And here I am talking about a market competition idea that actually came out of the Heritage Foundation. It was signed by by the governor of Massachusetts. Now, I forget his name. Yeah, Mitt Romney. I'm sorry. But, what are we talking about here? But, this is the whole polarization and ideological battle that creates all these problems and is not reality-based, unfortunately.
I think we have time for one more question back here. Okay.
Congressman Pallone, New Jersey has one of the strongest pharmaceutical presences in the nation. As someone who has supported both the Democratic platform and now the president's platform for lowering prices, but still has a major pharmaceutical lobby in your backyard, how do you plan to keep the noise at home under control while still pushing the agenda for the nation as a whole?
Well, to be perfectly honest with you, the noise at home in my district, which is headquarters and has so many pharmaceutical companies, as you say, is still very much the national noise coming from people who are concerned about accessibility and pricing, whether it's their insurance or it's buying drugs. I mean, I'll never forget, J&J is headquartered literally across the street from my district office in New Brunswick, Johnson & Johnson. And I'll never forget when, when I was first elected, they were manufacturing Band-Aids, and they, I think, moved it to Mexico. I hope they don't get mad at me and say that's not true. They had moved the manufacturing. And so the union, I think it was the union, asked me to come and meet with them because they didn't want the jobs to move to Mexico, wherever they were going. And I went there, and these were all employees of Johnson & Johnson. And all they did was complain about the high prices and, the high price of drugs. And I mean, they were no different than anybody else, even though they were working for J&J. So, the noise is no different. I mean, look, the industry is there in my district and around the country, and we want them to thrive. We want them, Senator Alexander talked about innovation and research. I mean, all that is hugely important. I don't mean to take away from it, but it doesn't matter, how many drug companies you have in your district. People are still very concerned about high prices, and they want us to do something, and they don't want to rely on the pharmaceuticals to do it on their own because they know that's not going to happen.
Right, Mr. Chairman, we are out of time. Thank you so much.
Thanks a lot.
Really enjoyed the discussion.